everyone, welcome to our channel, Canadian Nurse Expert. We nurses care for their patients with so much kindness and knowledge every day. That's why I want to help future nurses like you pass the NCLEX-RN exam. The NCLEX is a hard test, especially the part about mental health. There's a lot to remember about different conditions, but don't worry, we're here to make it easier. In this video, we'll go through 5 very important NCLEX-style questions about mental health. We'll talk about anxiety, depression, schizophrenia, bipolar disorder, everything. Think of this video as your helper, your cheat sheet to ace those mental health questions. Let's do this. Okay, future nurses, let's start with our first question. Imagine this. You're working, and a patient is feeling very anxious. They're pacing, wringing their hands, and clearly upset. The question is, what's the most important thing you should do as their nurse? Your options are: ask the client to stop pacing, administer prescribed anxiolytics immediately, encourage the client to sit down and discuss their feelings, provide a quiet and safe environment. Think about what's most important in this situation and choose your answer. The correct answer is to take the patient to a quiet and safe place. When someone is very anxious, their brain is on high alert. They feel overwhelmed, their thoughts are racing, and they need a break. Think about it. If you were panicking in a crowded, noisy room, wouldn't you want to go somewhere quiet and calm? It's the same for your patients. Reducing noise and distractions helps them calm down and feel more in control. Once they're calmer, you can talk about their feelings and ways to cope. But safety and a calming environment come first. Let's move on to our next scenario, this time about major depression. You're caring for a patient who tells you, "I don't want to live anymore." That's tough to hear, right? But many people with depression feel this way, and as nurses, we need to respond with care and knowledge. The question is, what's the best way for a nurse to respond? Your options are: don't say that, things will get better. Have you made a plan to harm yourself? Why are you feeling this way? You shouldn't think like that. The correct answer is to ask directly, have you made a plan to harm yourself? I know it can be hard to ask such a direct question, but it's very important. When someone talks about suicide, your priority is to find out how serious they are. By asking about a specific plan, you're figuring out if they're just feeling hopeless or if they've actually thought about ways to end their life. This information helps you decide what to do next to keep them safe. Remember, it's always better to be safe than sorry when it comes to suicide. On to our next challenge, and this time it's about schizophrenia. You walk into a patient's room and see they're very upset, saying they hear voices. They tell you, "The voices are telling me to hurt myself." This can be scary, but as nurses we need to stay calm and focus on our patient's safety. The question is, what's the best thing to do in this situation? Options are: tell the client the voices are not real. Ask the client what the voices are saying. Ignore the statement to avoid reinforcing the hallucination. Encourage the client to focus on reality-based activities. Think carefully about your response, remembering that these voices feel very real to them. The correct answer is to ask the client, what are the voices saying? Remember, when someone hears voices that aren't there, those voices feel very real to them. Don't dismiss their experience, try to understand what the voices are saying. Are the voices telling them to hurt themselves or others? Are they saying mean or scary things? By asking what the voices are saying, you can figure out how much danger they are in and what to do to help. This information is very important for keeping the patient safe. Alright, moving on to bipolar disorder. Imagine you're caring for a patient who is having a manic episode. They're pacing, talking very fast, and have tons of energy. It's a lot to handle, right? The question is, what should you do first to help them? Options are: allow the client to pace freely, offer a structured activity like group therapy, provide high-calorie finger foods and fluids, encourage the client to share their feelings. Remember, mania has unique challenges, so think about the client's physical and emotional needs. The correct answer is to give them high-calorie finger foods and drinks. You might be thinking, really? Food? But listen, during a manic episode, patients are so busy with their thoughts and energy that they forget to eat and drink. They can get dehydrated and weak very quickly. By offering them easy-to-eat, high-calorie foods and drinks, you're making sure they get the nutrition they need even when they're on the move. Now, moving on to general mental health interventions. Last question, and it's all about relaxation. You're teaching a patient with generalized anxiety disorder about different ways to manage their anxiety. They want to learn something that can help them feel less stressed right away. The question is, which relaxation technique works best for immediate stress relief? Think about the techniques you know and which ones can provide quick and noticeable results. Options are progressive muscle relaxation, cognitive behavioral therapy, group therapy, journaling feelings. The correct answer is progressive muscle relaxation. Here's why it works so well. Progressive muscle relaxation involves tensing and relaxing different muscle groups in your body, one by one. This helps release tension in your muscles, which then calms your brain and reduces anxiety. It's like a mini massage for your body and mind. It's a technique patients can use anytime, anywhere, to quickly feel less stressed and anxious. That's it for our 5 Mental Health Part 1 NCLEX-RN practice questions. How did you do? Remember, every question you try, every answer you understand, gets you closer to passing that exam. Mental health nursing is such a rewarding job, and I know you're going to be amazing nurses, providing kind and skilled care to those who need it most. If you liked this video, give it a thumbs up, subscribe to our channel for more NCLEX-RN prep videos, and share this video with your nursing school friends. Keep practicing, stay focused, and believe in yourselves. You've got this. Thank you for joining us. Keep practicing these questions to feel more confident.